Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Genital herpes is a common sexually transmitted infection. This infection affects both men and women. It is caused by the herpes simplex virus. There are two types of HSV, HSV1 and HSV2. HSV1 usually causes oral herpes, also known as cold sores. HSV2 is the primary cause of genital herpes. However, either type can infect the genital area. Genital herpes spreads through sexual contact. This includes vaginal, anal, and oral sex. The virus transmits through sores but also through skin not showing sores. Many people with genital herpes have no symptoms or mild symptoms. This means they can unknowingly transmit the virus to others. It's important to remember that genital herpes is treatable. While there is no cure, antiviral medications can manage outbreaks. These medications reduce the severity and duration of symptoms. They can also lower the risk of transmission to partners. Understanding genital herpes is important for your sexual health. If you have any concerns, consult a healthcare professional. They can provide accurate information, testing, and treatment options. Genital herpes often presents no symptoms. When symptoms do occur, they vary from person to person. The first outbreak usually happens within 2 weeks of contracting the virus. One common sign is the appearance of blisters. These blisters can develop on the genitals, buttocks, or inner thighs. In women, blisters may also appear around the cervix. These blisters are often painful and itchy. They may break open and ooze fluid, then crust over and heal. Other symptoms can accompany the blisters. These include flu-like symptoms such as fever, headache, and muscle aches. Swollen lymph nodes in the groin area are also common. Some people experience pain or burning during urination. It's important to note that not everyone experiences all of these symptoms. Some individuals may only have 1 or 2 outbreaks in their lifetime. Others may have more frequent outbreaks, especially in the first year after infection. Diagnosing genital herpes involves a combination of approaches. A healthcare professional will begin by taking a medical history. They will ask about any symptoms you're experiencing, sexual history, and overall health. A physical examination follows the medical history review. The doctor will visually examine the affected area for blisters or sores. They may also feel the lymph nodes in your groin for swelling. The most accurate way to diagnose genital herpes is through laboratory testing. A swab of the blister or sore is taken and sent to a laboratory. The lab analyzes the sample for the presence of the herpes simplex virus. Blood tests can also detect HSV antibodies. These antibodies are proteins your body produces in response to the virus. Antibody tests can't distinguish between HSV1 and HSV2. They also can't tell you when you contracted the virus. Section 4. Managing genital herpes, treatment and care. While there is no cure for genital herpes, antiviral medications can effectively manage the virus. These medications work by suppressing the replication of the herpes simplex virus. This helps to reduce the severity and duration of outbreaks. Antiviral medications are available in oral and topical forms. Your doctor will determine the best treatment option based on your individual needs. They may prescribe a daily suppressive therapy to reduce the frequency of outbreaks. Alternatively, they may recommend episodic therapy, which involves taking medication at the first sign of an outbreak. In addition to antiviral medications, self-care measures can provide relief from symptoms. Keeping the affected area clean and dry is important. Wear loose-fitting cotton underwear to allow for air circulation. Taking warm baths with baking soda or oatmeal can soothe the skin. Over-the-counter pain relievers like ibuprofen or acetaminophen can alleviate pain and fever. Section 5. Prevention is key. Reducing the risk of genital herpes. Preventing genital herpes involves adopting safe sex practices and open communication with partners. Using condoms consistently and correctly during sexual activity can significantly reduce the risk of transmission. However, condoms do not provide complete protection, as the virus can spread through skin-to-skin contact, even in the absence of sores. Abstaining from sexual activity when you or your partner has an outbreak is crucial. Open and honest communication with your partner about your sexual health is essential. If you have genital herpes, inform your partner so they can get tested and make informed decisions about their health. Getting tested regularly for STIs, including genital herpes, is crucial for early detection and prevention of transmission. Remember, knowledge is power when it comes to your sexual health. UMCC, your ultimate medical consultant connector.